Good afternoon, everybody. I've been called to this young child here who appears to have meningococcal septicemia. And as such, he's very peripherally shut down. The first thing I did was I walked in the room, I've assessed the dangers for myself, no dangers. I've done my paediatric assessment triangle, got to appearance and realised that this child is quite floppy, quite unwell. So we've decided this child is very unwell, so we're moving on from there. And as such, we've noticed that there's the child's been unwell, is running a fever, also has some petechial rashes and non-blanching rashes. So we've decided that we're dealing with a meningococcal septicemia or potential, and so we want to give some antibiotics. We also want to give some fluid therapy. As such, because the child is so shut down, we need to put an intraosseous needle in the child. We're using the EasyIO. Arrow EasyIO, which is the best on the market, the best the money can buy. So the first thing we do is we work out where exactly we're going to put the EasyIO or the needle and the intraosseous needle, and we've decided we're going to use the tibial plateau here, just distal to the knee. And the easiest way to do it is to work out 1 centimetre distal to the patella, in the slightly medial in the tibial plateau there. We'll get our drill set and our needle set, and using our finger, we'll just decide how deep we need to go, how deep that flesh is. And after doing so, we'll decide which needle set we need to use, and then we'll make sure that when we do put it in, that there's 5 millimetres between the black light, or between the skin and the hub of the needle. There's a little black line on the needles, and that'll give the game away. Just quickly, we need to see if there's any contraindications for intraosseous, and those include an infection over the site, a wound over the site we want to use, such as a burn, whether or not that bone has been had an intraosseous needle in it before, and the cortex of the bone has been exposed in the last 48 hours, whether there's a fracture in that bone, or whether there's another intraosseous needle already in that bone, in which case we'd have to go to the other leg, or we could use the humerus, the top of the humerus for this child. The child's quite floppy, really doesn't care. I think this little fellow's or lady is in a world of hurt and a world of her own, and I don't think this is going to worry them too much. So once we've decided what size drill we're going to use, once needle set, we place it in. We go to the depth of the bone, and then we drill till we hear a pop. Pop! Now that we've got a pop, we leave the drill in situ. We hold the needle set, and we take the drill off. We make sure that we don't drill while we're pulling off, or we pull it off straight away. We have to hold the needle set, the needle hub in position. Then we grab our securing tape, and we place it over the site, securing the intraosseous needle in position. We then connect our connecting tube, and with a syringe, we just do a little drawback. We just pull back and just see if there's any blood or marrow that comes out. May or may not happen, and if it doesn't, then we can flush some fluids in there, and if they go in relatively easy, we might realise that we're in the cavity that we need to be in. Then basically we give our antibiotics, our fluids, and we get this child to the hospital, give them a pre-notification, and let them know we're coming, and that's where we are. Thank you very much.